Hello and good day to you. This is Tracy Harrison from the School of Applied Functional Medicine. And I want to invite all progressive practitioners to join me today to delve into the most common reason why your patients and clients who are wrestling with chronic disease just don't get well. You seem to have powerful scientific insight. You have the ideal protocol. You have patient commitment and engagement. You focus on adding in the nutrients that they're missing, adding in helpful supplements and dietary choices. You work on removing the toxins and the infections that are at play in their chronic disease. And maybe they feel a little better for a time, but their chronic disease improvements simply aren't sustainable. And there's a powerful reason why. Welcome to Functional Medicine for Real World Impact, where we're diving into the complex, interconnected nature of health and disease, exploring not just theory, but practically what it takes to turn functional medicine insight into powerful, practical, real-world results. So please hit subscribe and let's get started. One of the most underappreciated truths in functional medicine is this: the body won't prioritize sustained healing unless it feels safe to do so. And the single most important gatekeeper of that safety signaling in the body is the vagus nerve. Far from being something that simply modulates our gut, the vagus nerve is an often overlooked regulatory hub that impacts everything from our breathing to gut function, including digestive secretions and GI motility. It is the centerpiece of inflammation regulation in the body and also plays critical roles in metabolic repair, fertility, and so much more. At SAFM, we teach practitioners that all healing interventions need three critical components. The first of these is to maximize what the body needs that it might be missing. And often this, of course, involves nutrients. We may have a standard American diet that is woefully deficient in key vitamins and minerals, or lacking adequate plant foods to give the body fiber and critical phytonutrients to enliven our biochemistry. We also teach the second component of that, which is about minimizing what is promoting disease. And this can be anything from a persistent infection to toxic overload, or perhaps a major source of free radicals or pro-oxidative damage. We want to maximize what the body needs more of. We need to minimize what is holding the body back or overloading it. Those are the two components that many practitioners using functional medicine principles well master. What is often missing is the third and perhaps the most critical component. It's not enough to maximize and minimize. We must also prioritize an environment for healing. And this is the component that is often overlooked. And if we don't intentionally call it out in our partnership with each unique patient, it's highly unlikely that it is going to happen. Picture any typical patient, certainly here in the Western world. They are feeling poorly. They have a lot of symptoms. Their energy is low. They want so much to feel better. And as they begin to restore some of their functional imbalances, they do feel better. Instead of 12 symptoms, now they have 10, then they have 8, then they have 6. And even the intensity of the remaining ones is waning. What does your typical patient do in that scenario? The body is making progress. We are restoring imbalances. Most people quickly and happily get right back to the lifestyle, the environment, the choices that promoted the disease in the first place. Often this is the very hectic schedule, the lack of sufficient deep sleep, the on the go, calorie rich, chemical rich, but nutrient poor diet, the same level of stressors and frustrations and responsibilities and duties, the same relentless voice in our head that may be constantly criticizing and countering our inner deep knowing of the value of self-care. We often forget or overlook prioritizing an environment for healing. Yet that is the key to helping the body to fully heal, going beyond that initial symptomatic improvement, but to fully heal and restore functional balances so that there is resiliency restored. And today, I want to share with you, first of all, a bit of an overview about the vagus nerve and powerful parasympathetic neural transmission. And then I want to share with you 7 powerful clinical tips and truths that all practitioners can use in terms of improving your outcomes through the power of vagal function. So first of all, let's talk a little bit about the vagus nerve. We all learned about it in your prior training. And to clarify the role of the vagus nerve, we need to take a step back, first of all, and talk about the sympathetic and the parasympathetic branches of the nervous system. This is not new to any of you, but as a gentle reminder, the sympathetic nervous system in general is quite stimulatory. This is our fight and flight neurotransmission mode that prioritizes survival. It runs primarily on norepinephrine. It is about marshaling and mobilizing resources, especially quickly. It is catabolic. And again, it is designed to promote survival. And this is a necessary function. We would not be alive here today having this conversation if human sympathetic response was not persistent. And indeed, we need sympathetic neurotransmission every day to stimulate our vibrancy and the metabolic flow that we need in order to thrive. On the other hand, our parasympathetic nervous system is very much about thriving. And there are many people in your practice who are not thriving to the extent they wish to, simply because they're making life decisions on a day-over-day basis that are promoting a sympathetic dominant nervous system mode. But at the same time, they're expecting to have a parasympathetic life experience. Of course, this is illogical. We can't be making choices to drive one physiological behavior and then expect the benefits, the symptoms, the experience of something that is quite opposite that. And indeed, thriving in our human experience requires both of these arms. If we need to rush and hurry in order to meet our goals, if we need to defend ourselves, if we need to be hypervigilant and focused to protect ourselves or to pursue activities and analysis to support our needs, sympathetic drive is critical. But as I said, many people in your practice are spending way too much time in sympathetic neurotransmission. And because this nervous system mode prioritizes survival, it necessarily deprioritizes other functions. And we're going to talk about a number of those today, because those parasympathetic priorities are often not only what your patients are looking for in terms of quality of life, but there are essential parasympathetic neurotransmissive effects that are key for healing. Of course, these systems are not opposed to one another. They are synergistic and necessary for survival and thriving. I like to think of them as being a bit of a dynamic seesaw, if you will. And optimal vagal health and function is an essential regulatory agent in the body to help us balance sympathetic and parasympathetic effects. Now, what is the vagus nerve? You likely learned that it is the longest cranial nerve in the body, and it innervates virtually every major organ system in the body. This includes the brain, the heart, the lungs, the entire GI tract, the liver, the kidneys, the spleen, the gonads. And it is 80 to 90% sensory and only 10 to 20% motor. This means that most of its signaling is afferent and it is actually flowing from the body to the brain, keenly surveilling the status of our world internally and externally in order to update our awareness of our environment and whether it's more appropriate that the body be prioritizing survival or prioritizing thriving. The vagus nerve is indeed the primary conduit of the parasympathetic nervous system. And many practitioners, especially in the world of functional medicine, often referred to the parasympathetic nervous system as being the rest and digest side of the nervous system, right? If fighting and flighting is sympathetic, then rest and digest is parasympathetic. And that is certainly true. At SAFM, we expand that phrase to say parasympathetic goes further than rest and digest. It also involves all of healing and, importantly, fertility. Rest, digest, heal, and make babies. Actually, the vagus nerve is a bidirectional highway that governs gut motility and digestive secretions. So think about its role in all of your patients who wrestle with IBS, distension, bloating, constipation, diarrhea. The vagus nerve governs heart rate and heart rate variability. So think about all of your clients who struggle with tachycardia, with POTS, with hypertension, with atherosclerosis. It also governs lung rhythm and breathing patterns. Think about your patients who struggle with asthma, for example, or various types of dysregulated breathing, shortness of breath, or poor oxygenation, sleep apnea. But it goes even beyond that. It plays a critical role in metabolic function. Think about your patients who have type 2 diabetes, who struggle with hyperglycemia, or maybe hypoglycemia, secondary to an overload of adaptive insulin response from the pancreas. But perhaps one of the most overlooked roles of the vagus nerve is its governing function of inflammatory, pro-inflammatory, and anti-inflammatory function. Via the cholinergic anti-inflammatory pathway, the vagus nerve, acting indirectly via the spleen, is actually the primary mediator of anti-inflammatory balance in the body. Let me say that again. The vagus nerve is the primary mediator of anti-inflammatory regulation in the body. Think about the huge world of your patients and clients who wrestle with a pro-inflammatory bias. This can result from any one of the chronic disease epidemics that we wrestle with today. We've seen more and more of it in the pandemic and in the years post-pandemic as we see cases of long COVID and post-viral syndrome, individuals who, because of microbial drivers or food-mediated drivers or nutrient depletion drivers, we can get stuck in a pro-inflammatory bias. This is a major driver of persistent chronic disease. And the vagus nerve is the often overlooked mediator of balancing that pro-inflammatory bias with anti-inflammatory response and relaxation, helping us to better apply the brakes rather than so much of the accelerator in the world of inflammation. I'm going to talk more about that in just a second. But the vagal regulation goes even further. It also includes neurotransmitter release and mood regulation. This includes things such as GABA and serotonin and dopamine and oxytocin signaling. But it goes even further than that because I mentioned making babies. And indeed, the vagus plays has a number of critical roles with regard to ovarian signaling and fertility, actually even bypassing the spinal cord for a direct connect between the brain and our gonads for promoting fertility and pregnancy and restoration of pregnancy. So it's a critical mediator of all things good, all things healing. All 7 of the areas that I just mentioned are critical areas of not only functioning, but vitality that your patients are looking for. In many ways, I also think about the vagus nerve as being a bit of a structural and functional bridge between neurobiology and immunology. And this is the nerve, if you will, through which emotional states can also affect our immune states. And we're going to talk more today about how we can affect the body's belief that our environment, our world is safe enough to allow parasympathetic neurotransmission, therefore to allow healing. And it's going to take cues and clues based on our behavior, not just our exogenous environment, but it's going to take cues and clues on our behavior. And that does include our emotions and our response to our emotions. Chronic fear or grief or overwhelm, a major source of which is often that relentless voice in our head, are going to signal a perpetual threat, something we need to survive. And the vagus nerve often simply responds accordingly and dials down its innervation and enlivening of critical functions like digestion and anti-inflammatory support and fertility, dialing those down in favor of survival. What this means is that oftentimes what your patients are wrestling with is not a reflection of anything in the body being broken. Instead, it is expected physiological functioning to prioritize survival. Again, where mostly what your patients are looking for is an environment for thriving. And indeed, when our vagal tone becomes poor, and we're going to talk about some of those reasons in just a moment, this is where your patients and clients may start to complain of bloating and distension. They wrestle with infertility for long periods of time. They have chronic joint pain because of excessive inflammation. They feel unable to get on top of their metabolic dysfunction. So to summarize, vagal transmission and parasympathetic function in the body is not just one piece of the functional puzzle of disease. I encourage you to think about it as being the puzzle board, because if it's dysfunctional, pretty much every downstream system suffers. So now I want to briefly describe to you 7 key truths, clinical tips about vagal function and its effect on healing. Number 1, want to come back to the notion of this being the primary regulator of immune balance. We know that sympathetic neurotransmission out of control and can wreak havoc on the body. Very high levels of stress hormones, cortisol, norepinephrine, epinephrine can help us to fight and flight and survive, but too persistent or long-term can wreak a tremendous amount of havoc on the body. The same is true for inflammation. We speak about inflammation sometimes as though it's fundamentally evil. And of course, this is not true. We need the ability to get dramatically inflamed if indeed our immune system needs to protect, defend, or repair. But it does so at a cost. It takes a tremendous amount of cellular energy to drive immune function, and the activity of all types of immune cells and cytokines and interleukins, they not only take great energy to produce, but especially the pro-inflammatory bias can wreak an awful lot of oxidative stress and damage on the body. It's the cost of having an aggressive, effective immune system. Again, if you're trying to fight something or defend and protect yourself, it is necessary for survival. But often our patients struggle with chronic inflammation and indeed immune dysregulation. And without vagal control, macrophages and pro-inflammatory cytokines can spin out of control. And this can lead to overactive immunity that can also become dysregulated and lead to autoinflammatory or autoimmune dynamics that are pervasive in our practices. And as I mentioned, the cholinergic anti-inflammatory pathway is essential. Many practitioners are surprised to be reminded, because I think this is something we were all taught in our initial training, but to be reminded that parasympathetic activation and the triggering of this anti-inflammatory pathway inhibits NF-kappa B, a major immune regulator, and reduces pro-inflammatory cytokine release, especially things like TNF alpha and interleukin 1 beta and IL-6. IL-6 especially critical for being able to avoid an excessive inflammatory buildup that can have a negative effect on the blood-brain barrier and opening the gateway for neurotoxicity. And instead, we can promote more anti-inflammatory response, for example, via interleukin 10. But when vagal tone drops and sympathetic neurotransmission dominates, then the body is naturally going to have more of that pro-inflammatory bias that is going to become a major source of redox imbalance, too much pro-oxidant damage without a break, without the opportunity to heal that tissue. Again, inflammation is great, but imbalance is what ends up promoting long-term tissue damage and dysfunction and an inability to fully heal. Now, number 2, the vagus nerve is informed by and involved in regulating our breathing. It's important to think about breath as being not only a source of oxygen and the release of carbon dioxide and toxins and other metabolic byproducts, but breathing is a master switch of resilience. In fact, research well shows that when we breathe shallowly or rapidly, especially superficial or chest level breathing, or when we breathe through our mouths, this can drive a sympathetic bias. But when we are breathing through our nose from the level of the diaphragm and the gut, especially with extended exhalations, this can help to reset the vagus nerve thousands of times a day. In that sense, diaphragmatic breathing, every belly breath, is actually massaging the gut and stimulating motility. And this is why intentional breathing, mindful breathing, box breathing, 4-7-8 breathing, there are all sorts of different methods that can help to purposefully trigger a parasympathetic nervous system state. can be a critical self-care activity for healing. In fact, practitioners often know in the functional medicine world that mindfulness activities and calming activities are key, especially in many of our super busy stimulatory lifestyles. But often practitioners go to mindfulness behaviors or activities that might be too challenging for their patients to access right away. We want to go right to meditation or go right from a crazy stressful lifestyle to daily Tai Chi. I am a big fan of meditation and Tai Chi and yoga and all sorts of richer mindfulness practices that simply require a bit more focus, perhaps a little bit of training, and a comfort level with settling into a parasympathetic response. For a lot of your patients and clients who are already stressed out, this type of behavior can feel overwhelming. It can feel inaccessible, that they may absolutely believe that it would help if they could access it. I often find that simpler recommendations may be more accessible, and mindful breathing, even setting a reminder on your phone, say every hour, to carry out just 2 minutes, 3 minutes of mindful breathing, taking a moment, closing your eyes, setting your phone aside, and practicing some sort of mindful breathing for just a few minutes. If we use a cell phone reminder to do this, it can become a habit that can powerfully affect our nervous system balance, even while our mind might still be whirling with worries and stressors. We have to begin where we are. Another suggestion is gratitude journaling. A focus on gratitude tends to naturally focus our mind on the glass half full and to bring up positive emotions of what we are appreciating in our lives. And that can also be powerful for parasympathetic neurotransmission. Stay with me. I'm going to give you a whole basket of other purposeful parasympathetic stimulating activities in just a moment. But suffice it to say that breathing is powerful. The vagus is informing our subconscious way or unconscious way of breathing. But when we consciously breathe in a way that signals safety and security to our nervous system, we also help to trigger parasympathetic response. Now, number 3, you cannot restore optimal gut function without prioritizing vagal function. Indeed, I think the gut's best friend is really the vagus nerve. When we think again about the huge number of people in our practices who struggle with belching, bloating, distension, GI pain, diarrhea, constipation, GERD, all of these types of symptoms, it's quite common that poor vagal tone is a component of the gut dysfunction. In fact, we need to remember that the act of digestion and absorption and motility, that trio of key functions in the gut, are actions of the parasympathetic nervous system. If we're eating a meal in a very stressed state, rushing to meetings or ruminating in our head about a stressful relationship or a conversation we just had, it only makes sense that we're going to have dyspepsia, that we're going to have some GI distress on the other side of that meal. We need to relax into a parasympathetic response to have optimal digestive secretions, from stomach acid to pancreatic enzymes to gallbladder emptying. We need good parasympathetic transmission to have optimal peristalsis and motility in the GI tract as well, and also to keep our mucosa healthy so that we have optimal nutrient absorption. We We often struggle with GI dysfunction simply because we're trying to prioritize the gut and the act of fueling our body with nutrition while we're in a sympathetic dominant nervous system state. And in exchange for fighting and flighting and trying to survive, the body naturally deprioritizes digestion. It deprioritizes detoxification. It deprioritizes a lot of immune oversight. It deprioritizes detoxification and clearance of chemicals and endogenous waste products. And it deprioritizes fertility. It's doing this on purpose in the name of survival. And so we know that so much disease begins in the gut, whether it is localized in the brain or in the elbow or in the liver or the kidney or the ovaries or in the nervous system. But what happens in the gut does not stay in the gut, whether that is the effects of good digestion or maldigestion, whether that is a result of good immune balance based on a healthy, diverse microbiome. So the immune system does not become dysregulated and hypervigilant, and we acquire eczema, atopy, autoimmune disease. And also the notion of gut barrier function, right? The adage of good fences make good neighbors is critical in the body as well. We need preservation of microenvironments in various cavities. And the gut lining is a very well-honed semi-permeable barrier. And many people in our practices struggle with some degree of enhanced intestinal permeability. And when we have high stress environments, this can overtly lead to degradation of the protective mucosal lining of the intestines and promote over time progressive increases in permeability. And this is where inflammation that might begin in the gut can actually spread to have systemic effects. Actually, a major driver, for example, of arthritis in any of the joints in the body. But in the interest of time, let me move on, because point number 4 is an especially critical one. It is not our stress that kills us. This is something I hear many practitioners misspeak of. And certainly we need to be passionate about the role of stress in promoting chronic disease. But there's a nuance here that's essential. We shouldn't be afraid of stress because stress is unavoidable and people can become neurotic and obsessed and overwhelmed by trying to avoid all stress. We live in the modern world and stress is ubiquitous and from so many different avenues in our lives. It's not the stress that kills us because the body is actually designed to weather all sorts of even quite acute stressors. The catch is it's designed to weather them for a period of time. The disease-promoting aspect of modern stress that is creating and perpetuating so much disease is that the fact that the stress never ends. We seldom are able to return fully from a fight or flight mode into that parasympathetic mode. And that leaves us in a state of vagal dysfunction. Chronic low-grade stress is the nemesis that sabotages the system. Instead of having episodic strong stress that we counter, we handle, and then it's over, and we prioritize resting. We actually allow resting. In the US and in so many of our communities, resting is perceived as some sort of weakness. Only people who are not powerful feel the need to rest. Only people who are not resilient and strong feel the need to rest or have the need to rest. Sometimes people brag about just how little sleep they need or just how much they can keep burning the candle at both ends and in the middle. And they perceive that they're still thriving. But if you're a practitioner familiar at all with functional medicine principles, you know that nothing could be further from the truth. That approach always catches up with people. because the body is not designed at all to weather stress long term in a multifactorial demanding mode and still thrive. The body will do its best to survive, usually with an awful lot of dysfunctions and symptoms and suffering, loss of quality of life, if it has to always be in that fight or flight mode. If, however, we are looking for a life experience of high vitality, then we need to be able to prioritize an environment for healing. We need to prioritize a time of rest and recovery on the other side of a stressor. When we are sick, say with a viral infection, we should not wait for the very first day that we sort of kind of start to feel a little better and then rush right back out to start doing it all over again, immersing ourselves in the very environment that promoted our vulnerability to viral illness in the first place. The first day you start to feel better should be a day of affirmation when we make the decision to prioritize the body, when we make the decision to keep prioritizing ourselves and move from an improvement in symptoms to actual healing by allowing a time of rest. This is where the body can recover from the battlefield that has been created in the infectious fight. Tremendous amount of oxidative wear and tear, recovery that is needed on the other side of maybe a toxic challenge, for example. We have to honor rest as being not a form of weakness, but a courageous choice, a powerful choice for self-care and resilient healing. So we come back to a place of actual vitality, not limping along, not still trying to get by in a sympathetic dominant state, but a place of actual healing. And this can be really challenging for people in particular if there has been trauma. Something more acute, more devastating, because this type of life experience can actually leave fingerprints, if you will, in our vagal circuits. And especially if it happens early in life, can lead to priming of the amygdala for more of a hypervigilant type of nervous system response to life. And so we have to be even more purposeful about activating parasympathetic response on purpose in those environments, and beyond behaviors and more everyday lifestyle choices. We might actually need the assistance, for example, of overt vagal stimulation. There's some wonderful devices that have been developed over the past several years. We've long had more clinical professional vagal stimulation tools, but within the past decade, we've seen the development of really neat, affordable devices like the True Vega, which you can use for your own direct stimulation of your vagus nerve, which is another thing that people can do, again, in the face of crisis or trauma, where we're working on calming down the mind. We're working on entraining the parasympathetic nervous system anew, but this can take time. It takes persistence, and overt vagal stimulation in the interim can be a powerful tool for getting those physiological and biochemical benefits for the body. But it's also important to teach your patients and clients that even away from trauma, unresolved grief, fear, anger, rage, lack of forgiveness, these types of things can simmer inside of us and be something that the subconscious mind, if you will, is trained to go back to over and over and over and over again, and keep primed behind the scenes a perpetual state of insecurity, a perpetual state of hypervigilance. Even when we're trying to present a confident, safe exterior, we may say all the right words, Of course, our nervous system is eavesdropping on our thoughts and on our emotions. And if our inner world is one that signals, no way, no how, it is not safe to deprioritizing fighting and flighting in order to prioritize an environment for healing, for durable, sustainable resolution of disease that actually allows vitality. The truth is that all durable healing is from a parasympathetic state. Now, I do want to say a word here about, like anything else in the body, too much of anything can perpetuate disease, just like too much inflammation, too much sympathetic neurotransmission, for that matter, too much cholesterol, too much estrogen, too much calcium, right? Lots of good things in the body can overload our functional systems. The truth is that there are some examples where individuals can end up with too much parasympathetic activity. And this is something that polyvagal theory, for example, highlights how the vagus nerve likely has branches. It is the ventral branch that I've been speaking to here that really enlivens connection and a sense of security and engagement. But of focus on too much dorsal parasympathetic neurotransmission can lead to more of a freeze type of response that you often see in the patients who are trying to really hide from the stressors of their life with more of a withdrawal, a suppression. Individuals can get stuck in a parasympathetic state where there's not enough stimulation. They tend to be exhausted. They are struggling to have enough innervation of key vital functions in their body in order to promote getting up in the morning with energy and zest and goals and focus, motivation, connection, these types of healthy drives that promote vitality. So healing requires engagement, in particular of this ventral vagal system, which again is tied to engagement, safety, connection, repair. Depending on whether or not we feel safe or whether we feel threatened, the vagus activates different circuits that are going to promote more of that healing drive or potentially shutting the system down entirely. So, point number 5, it's important to consider what might overtly promote vagal dysfunction. A key principle is that the nervous system, the central nervous system, the peripheral nervous system, the brain are all heavily affected by any injury or insult to the head. Long ago concussions, especially repetitive concussions, can still be causing poor vagal transmission many years later. If there have been surgeries in the neck or the shoulders or the chest, if there have been chronic infections, especially high viral load, if there is toxicity, especially heavy metal toxicity, perhaps mycotoxicity and other types of toxic overload, in particular, that might cause mitochondrial dysfunction. It's critical to remember that the vagus nerve is a nerve, and nervous tissue needs critical nutrients for thriving. So deficiency of vitamins, in particular vitamin B12 or vitamin B6, can lead to poor anatomical functioning of the vagus nerve. If individuals already have some degree of neuropathy in other tissues, we want to think about, is this also impairing vagal transmission and affecting the gut, affecting the lungs, affecting the ovaries? It's also true that we need good posture. And so, especially now with so much text neck and chronic sitting, leaning into a computer monitor, we're losing the anatomical balance that helps to prevent impingement and ensure optimal neurotransmission throughout the whole torso that the vagus nerve enlivens. And indeed, as I've been mentioning, trauma, crisis, emotional stress, there are some of those aspects, certainly triggers that we may not be able to control, but beginning to look at our internal response and becoming more mindful of it. There are many different factors that can promote poor vagal transmission. Mitochondrial dysfunction is a hot topic in the functional medicine world right now as we learn how much oxidative overload and high viral load and poor omega 3 fatty acid sufficiency, low levels of CoQ10. There's so many different common challenges that lead to poor functioning of the mitochondria in our cells. Nervous tissue, neurons are particularly laden with mitochondria. When we have poor mitochondrial function, the nervous system is often the biological system that suffers the most, and indeed often suffers first. This might show up, as I said, more peripherally in terms of affecting the gut or the lungs, or centrally, affecting the gut and the lungs, or more peripherally in terms of numbness and tingling. But it can also specifically have an effect on the vagus nerve and how it affects our immune system. Critical things to think about in terms of our intake sessions and our patient and client follow-on sessions to make sure we're doing deep investigations as to all aspects of history and current environment that might be promoting poor vagal function. Number 6, I want to talk about heart rate variability. This is a critical measurement that reveals the flexibility of the nervous system. Research has been showing for a long time that higher heart rate variability is a marker of greater nervous system resilience. And there are all sorts of devices these days that can help you to assess your heart rate variability. In fact, there's no perfect number. The goal, I think, for any of us should be to assess it and consistently improve it, become more mindful and aware of how our nervous system state and our aggregate environment, especially our inner world, is driving our cardiovascular system to respond. Greater heart rate variability helps to create higher adaptability and both cardiovascular and metabolic flexibility for weathering both expected and unexpected challenges in our lives. The more time we spend in parasympathetic nervous system state, as I said, assuming we're not stuck in that mode, which is a notable and a true disease dynamic, it's just rare. But being able to activate this parasympathetic neurotransmission that helps to increase heart rate variability, as I mentioned earlier, we can use devices to stimulate it. But lots of times patients are shocked to find all the different things that they can do to activate parasympathetic response on purpose. And it tends to be a lot of things that we might do without thinking. Gargling, humming, chanting, singing, snuggling, giggling, laughing, playing with a pet, simple everyday things, yoga, tai chi, things that help us to connect with larger truths and appreciation in our lives that deflect from a focus on the worries and the threats that we perceive in our lives. There are lots of simple things that all of your patients and clients can access in order to train our nervous systems into greater vagal tone. And in number 7, I just want to summarize that healing is state dependent. Please teach your patients this truth. It's not enough for them to do all the right things, prioritize all the things that need to be maximized, prioritize all the things that need to be minimized. If we fail to prioritize an environment for healing, prioritizing rest, gratitude, joy, appreciation, reflection, prioritize self-love, positive self-image, prioritize giving in a way that doesn't drain us, prioritizing activities and emotions that help us to feel safe, to give our nervous system proof that it is okay. It is a safe thing to prioritize parasympathetic response, that our survival is assured, and we can risk the possibility of thriving. True repair, tissue restoration, gut function and nutrition, detoxification, fertility, anti-inflammatory balance. These all are activated via a parasympathetic state. And without good parasympathetic balance, courtesy of optimal vagal function, my friends, there is just no doorway to sustainable healing. Instead, what we often confront is the revolving door of disease and recurrence that is so frustrating for patient and practitioner alike. So again, to summarize, the vagus nerve is not just another puzzle piece in the functional medicine puzzle of disease. It is the board in which all of the other puzzle pieces come together. I think of it as a central regulator of resilience and vitality itself. When vagal tone is weak, the body stays locked in survival mode, unable to prioritize durable repair. But when we restore that vagal integrity and signal security to our nervous system, then we give the body permission to heal. So please be sure to prioritize this essential component of healing in all of your patient and client encounters. Do a deep investigation of what might be holding back vagal neurotransmission on the anatomical level, the physiological level, the biochemical level, as well as the emotional and mental levels, and prioritize an environment for healing so the patients and clients you serve can find that vitality, the true healing and vitality that they seek. Thank you so much for joining me. Have a great day.